to do what's happening in the cities, which is virtually all the independent hospitals are joining big groups. I ran a hospital that was part of the University of Maryland, so I got a lot of experience inside systems. And we as a community are not ready for that. That would be a tremendous shock to us to become part of something bigger. And would cause us, I think, to get out of focus and not necessarily achieve the kinds of things we need to achieve in the next couple of years. So this is a much better route, we think, for us. And we're in the catbird seat because we're in the middle of it, so geographically we can benefit from virtually any and all of it being in the middle. Not a lot of clinical play in it. The medical staffs don't know each other, and there's really no reason to pretend like you're going to get much done clinically if the physicians aren't engaged in it and supporting it and driving it. That may come with time. We'll just have to see where the healthcare system goes, but for now, that's not mainstream. So does that make any sense at all? How about if you, we just kind of go around the room and see if you got any questions or comments you want to make. I try to avoid throwing things at you. Particularly hard objects. I asked them not to put hard objects in, so they took the sodas out this time.
There's some here.
The orange is a little scary, I can see that. Anything on your mind?
I'm trying to think. I have thought of something. Wait a minute. I have to. With more people, hopefully, acquiring health insurance, will the hospital get busier?
I'm sorry, will we do what?
Will the hospital get busier?
Well, I think there will be some what I'll call latent demand. Although to tell you the truth, I think it's going to be bigger impact on dental care. Because I think people find a way to get their urgent care. They come to the ER now. And what's not occurring is chronic care, like dental care and blood pressure management and whatnot. So it's going to very clearly have a big impact on the outpatient side. And we're trying to recruit more primary care doctors. We're trying to recruit another diabetes physician because we think a lot of these patients are going to, present with those kind of needs immediately. Whether it'll drive a lot of inpatient or not, it's hard to know because we don't know the age of the people that are qualifying. But if you think about it, it's not going to impact OB because if you're going to have a baby in Maryland, you're eligible for coverage and we cover you. And that's smart because we don't want sick babies. And it makes all the sense in the world. I think who's going to get covered are the working people that don't have insurance. And I think that age group is like 30 to, call it 60. It might be a little bit older, a little bit younger than that. And I think there's going to be some need in that group. I do not think it's going to have a big impact on inpatient, though. I think it's mostly going to be outpatient impact. That's going to be a population that hasn't had a colonoscopy. It's a population that hasn't had other cancer screens. They haven't had mammograms. That'll all drive them downstream. You screen 100 people, you're going to find something. And we think in our county, in Washington County, we think it's probably about 15,000 newly insured people. So, assuming that they can get on and get enrolled.
We're having that issue.
Did you try?
My husband's been trying. I'm actually retiring. Friday's my last day.
Oh, congratulations.
Thank you. And I can't afford to have Aetna through Meritus because it's just too expensive for he and I. And we're not Medicare eligible yet. He's been trying since October to try to get in. And finally, we got a call yesterday from a different source, not the state of Maryland, to try to help us.
Was it,
We do have a navigator on site, and I can give you the dates that the Health Connection navigator for Maryland will be here.
Okay.
Healthy Howard is the
Yes,
organization?
that's
Yeah.
who it is.
So
That's-
she's already in touch with
Yeah,
us?
she's
Kate.
already started here, but she wasn't getting any referrals. So they sent her back over to Howard County, but there are specific days she'll be here on site, and I can.
Is her name Kate?
I'm not sure.
Yeah, that's who Ed's been talking to. Kate who helping Howard.
Well, they wanted to get this out there and they moved too quickly. You know, websites aren't easy to build, especially interactive ones that have to interface with insurance company websites and they have to be secure. And what's the term, hot coding? So they're building it while they're running it, and that's never good. Never good. Would you want to fly on an airplane they were building it as you were flying?
I don't think so.
Me either.
I think the main hangup is because I am retiring and he has been drawing his Social Security, our salaries are going to change because I'll be drawing Social Security starting February. And that seems to be an issue. The system can't recognize that there's two different incomes for 2013, 2014. It's just been quite a little mess.
Think about this. As expensive, think about taking COBRA till your new income is your new income. And talk to that counselor about whether that would make any difference. So maybe you only file with one income, the prospective income. Your tax returns are still gonna show a higher income, but you've had that intervening event, and you can then project what your income, because you know what your Social Security is gonna be.
Yeah. Okay,
Maybe you can do that.
okay.
Amanda?
I think the wellness center is a really good idea. I think that a big issue in this community is that we have a very poorly educated community. So I think that the wellness center is a good idea, as long as education comes with that, and of course they're urged to make those changes in their life. That's a plus for me. I do have questions regarding, I guess a lot of it is a lot of the education that we do here. I know that the Learning Hospital has always been a learning hospital, which is wonderful. With the changes that we're making now where we are only hiring BSN nurses, I guess my question is, why then are we continuing to bring nurses here that are only going to graduate with an AA degree? I'm seeing on my units that they're sending 15 to 20 some students on one unit that pretty much overrun the unit, overwhelm the nurses, take up the computers and everything. It's a very, I think, hard situation on that nursing unit when they're overwhelmed like that. So I guess I'm just questioning why we're going to continue with that when they're not going to get a job here.
Well, a lot of questions in your one question. We do have an educational mission, so you've got these long-standing relationships, and even though our need has shifted more toward critical thinking skills, away from technical skills, you've got these, community structures in place that need to exist. There are jobs involved, and while we might not have a place for an associate today, others are still using them, so it's, I don't mean it literally, but it's your kids and my kids that are in these programs. And So you gotta keep the programs going. So that's part of why you would continue to be engaged with the associate programs. We also know in the case of HCC, that they have built into their structure now a 2+2 program, so that their associate folk can transition right into the bachelor's achievement program. We need our nursing home staff, so we need these folks coming out of nursing schools. They're still all getting jobs. They're not all in hospitals anymore, but they're all getting jobs. So it's sort of keeping the sort of healthcare macro going and giving those associate programs time to adjust and whatnot. Having said that, the other question, you didn't ask it quite this way, is as the census, you know, as we get better at readmissions, there are fewer inmates. And we got the same number of students, and now with the reliance on the computers, and so I think what you see is an old process that's been impacted by the environment that needs to be rethought. And I made a note I'm gonna have, after the first of the year, I'm gonna have process improvement, performance improvement, take a look at doing a Kaizen around educational assignment. We may need to start talking to the schools about Saturdays and Sunday clinic, and then we really have not done a very good job of figuring out how many computer terminals we actually need. We had a vendor come in and do that, but it was really poorly done. It didn't, you know, you ended up with a report you couldn't make any decisions on. And we haven't put our own process people on it, but we need to make some decisions. You know, how many people are going to use portables and how many people are going to use stationary workstations, and where are we going to put them and all of that. We've been talking about it for a year and a half. It is a problem. So I think how we educate, you know, how we create a good student experience, and we may have to force rank it a little bit. But, you know, HCC is an example. They're already sending kids to Winchester to get experience, because, you know, the city hospital in Martinsburg is not that big, but it's full of students too, because you've got West Virginia Technical, you've got Shepherd in there, plus you have a residency program, which is more students on the unit, so they're kind of crushed. I know Shippensburg goes to Chambersburg. I don't know if anybody else goes to Chambersburg or not. Does anyone live in Pennsylvania?
I used to.
I don't know if Penn State, they have a campus down this way. Alto. I don't know if they have a nursing there or not.
And I think Wilson had.
Wilson
a
has
program,
nursing, that's right.
But I'm not sure. I would guess that they would go to Summit, Chambersburg.
Yeah. Well, you know, if you can get a nurse in two different hospitals, they're a better nurse when they come out of training, getting that
That's what I
other
was just gonna
experience.
say. They have to have, in my opinion, and I've worked in hospitals all my life, in nursing areas, they need the practical experience. You can have all the knowledge and learning possible from books, but until you can apply it to a patient and see what happens when these processes you're learning are actually happen, you have to have that experience. You have to have hands-on, because somebody still has to take care of the patient's needs.
Yes, and that's, I think, partially what I mean, where when the nursing unit of maybe 8 nurses to take care of, you know, they have maybe 3 rooms each, are bombarded with that many students, how much of their time is taken away from their patient care to educate that person? If patient safety, and with the core measure issues now, I mean, as they break it down, with hand hygienes and stuff like that going down, it seems to get worse, I've noticed, when we have students, because they're being secret shopped too, along with staff. So just